Today's topic is regarding pulp spaces of the digits. It is a subcutaneous space on the palmar aspect of the tip of the fingers and the thumb finger. The pulp space is filled with the subcutaneous fatty tissues. Fingertip pulp is divided into a number of small compartments with the help of fibrous septa, and those fibrous septa consist of the fat. Can you see here in the diagram, this is known as the skin. Same or this is known as the terminal phalanges, and something which is connecting the skin to the terminal phalanges is known as fibrous septa, and this fibrous septa is dividing the pulp space or the fingertip into small pulp space. Let's know the boundaries of the pulp space. So we have superficial and deep boundary. Superficial boundary is found by the skin and the superficial fascia, and deeply it is found by the distal 2/3 of the terminal phalanges. Now we have some peculiar features, or we can say features of the pulp space. So this space is traversed by the numerous fibrous septa that is attached from the skin to the terminal phalanges and divides the tip of the fingers or thumb into small space that is known as the pulp space, also known as the loculi. But this green color fascia is known as the deep fascia. So this deep fascia of the pulp of each finger fuses with the periosteum of terminal phalanges that is distal to the insertion of long tendons. Now we have the term known as digital artery. This digital artery supplies the diaphysis of the phalanges, which runs through the pulp space. But this part of the terminal phalanges is known as epiphysis of terminal phalanges. Now the epiphysis of the distal, the phalanges receives its blood supply proximal to the pulp space. It means the epiphysis which is getting the blood supply is not passing through the fibrous septa, that is not passing through the pulp space. It means if pus is accumulated in the pulp space, it means this part of the artery which is supplying to the epiphysis of terminal phalanges, it is not getting damaged. It means necrosis won't takes place in the epiphysis of the terminal phalanges, but the necrosis can take place in the remaining part of the terminal phalanges. Pulp space infection, it is the most exposed part, that's why infection can take place near the tip of the finger. The pus or abscesses in the pulp space is known as Whitlow, also known as Fallon. So there can be a thrombing pain, and it is drained by the lateral incision. If it is neglected, necrosis of the terminal phalanges takes place. Can you see here in the diagram, we can do the lateral incision near the tip of the fingers.